Hi, I'm Abby Grace Hollingsworth. I'm from Clayton, North Carolina, but I've been inside the Wilmington and Carolina Beach area for most of my life. I graduated with my BSN from UNC Wilmington in 2023, and I had such a great experience there. I'm pursuing the DNP program at UNCW as well. I believe the DNP program better suits me because I really enjoy teaching and precepting, and I could see myself wanting to be a teacher in the future. I'd really like to have that door open. Although I know that MSN and DNP programs both adequately prepare nurses to be nurse practitioners, I really am interested in having more clinical hours and more evidence-based practice in becoming a nurse practitioner. The work experience that I have is that I am an emergency department nurse going on 3 years, as well as a fertility clinic nurse, PRN, for a little over a year now. I am interested in becoming a nurse practitioner because I really have a desire to be a more autonomous part of the healthcare team for each patient, and I really enjoy getting to know patients long term instead of the quickness that I see them in the emergency department. Some personal attributes that I believe are important in becoming a nurse practitioner is being kind and listening. I believe that if you meet a patient where they're at, be non-judgmental, listen, and just show up with kindness, that you'll be able to take care of them both mentally and physically, and you'll be able to break down some of those walls and hear out some of the barriers they may have that's preventing them from having care. I believe that the diversity that I've experienced in the emergency department, as well as the fertility clinic, has really prepared me for that role. I've been able to take care of people across the lifespan, few days old, as well as over 100 different diversities, cultures, languages, and attitudes towards healthcare, and meeting them where they're at, listening to them, and providing the care that they need has been really a blessing. A long-term goal that I have and that I'm getting to live out now is that I am a camp nurse volunteer 1 week of the summer since I've gotten my BSN at a camp called Camp Willow Run. It's a camp that I went to in middle school and early high school, and it really just taught me how loved I am and also gave me a bunch of skills in lots of different things, as well as sailing, basketball, archery, things that you don't really do every day. And it is providing a camp experience for 80 to 120 campers per week. I went when I was in middle school, and I like to do the middle school week just because that's when I went as a camper. And it's got some obstacles because I'm stepping into a more autonomous decision-making role while I'm there. I'm the only healthcare provider there, and I have to be the one to decide if something needs urgent care, emergency, or something that I can fix inside my boxcar. As well as it's care with limited resources because, once again, we're in the middle of nowhere and we're in a boxcar, and as well as communicating with their parents because they are kids. These things have really encouraged me and have helped me see that I would really enjoy becoming a nurse practitioner. And I really appreciate this opportunity, and I look forward to the future. Thank you so much.